What's good? It's your boy Jay with the J Academy, and today we'll be going over the respiratory systems and its disorders. So let's get started. Alright, so first I'm going to explain about how the respiratory system works. So its main job is gas exchange. So it wants to get that O2, that young oxygen in, and the old CO2 out. Alright, so that's his main job. That's his 9 to 5, right? Alright, so I'm going to explain to you how it works. So then the air can either come in through the nose or the mouth, where it travels down the pharynx, then the larynx, then the trachea, and then it splits into two bronchi, one for each lung. Then the bronchi split into smaller pipes called bronchioles, and then at the end of a bronchiole is an air sac. Right, and so then this air sac has like little bubbles on it, and that's for extra surface area so you can get more gas through, right? And so then here is where the gas exchange occurs, and it has a blood supply of tiny little veins and tiny little arteries, and so then in the air sac, the membranes are actually very thin. So then the air can just directly diffuse across the membrane into the blood vessel, where it gets oxygenated and where it can get pumped to the rest of the body. So that's how it works. Now let's get into the disorders. Alright, so I'm gonna go into a brief overview over the types of disorders that can happen. And so here's a normal lung and its blood supply. So here's the blood supply, it's normal. And here's the alveolus, it's normal as well. And here's a normal bronchiole. It's not, there's no blockage, it's good. So what usually happens, what normally happens is that the air, fresh air goes into the alveolus, diffuses into the blood, then the CO2 goes back from the blood to the alveolus and then comes out when you exhale it. That's normal, that's great, that's what it should look like. However, of course, lots of things can go wrong in the body, and one of the things that can go wrong is when the alveoli are filled with fluid. Right, so here's the alveoli. It's filled with fluid. The fluid can be something like pus. It can be blood. Right. This can be caused by pneumonia when you have an infection. Right, it fills with like fluid, like pus. Stuff like that, bad stuff. You don't want that. It can also be caused by pulmonary edema and acute respiratory distress syndrome. So when it fills with fluid, you can't have the air in it, obviously, because it's filled with fluid. So no air right here means no air for the blood, and now you're feeling out of breath, which is not good. All right, so the next category is a restrictive lung disease. In restrictive lung disease, the alveoli is actually very stiff, so it's hard to expand, very hard to expand. Now, that means that it's very hard to inhale, right? And if it's hard to expand, hard to inhale. Now, the stiff alveoli, it can be caused by stuff like inflammation, say if you have chronic inflammation from lupus, or it can also be from abnormal connective tissue. Right, so that could cause the alveoli to become stiff. Now, the next category is obstructive lung disease. In obstructive lung disease, here's the bronchiole, right? Here's the alveoli, and here's the blood supply. And in obstructive lung disease, the bronchiole is actually obstructed, right? This can be from mucus if you smoke a lot. And then it's very hard to exhale, right? It's actually very hard to exhale. So what it feels like is when you take a very deep breath, right? But then you try and inhale more without exhaling. It's very hard to get in more air when you already have air in there, right? That's what it feels like to have an obstructive lung disease. And so some examples are COPD, which covers the term COPD, which is chronic obstructive pulmonary disorder, covers two old terms, which are emphysema and chronic bronchitis. So those two terms are covered under COPD. And then another obstructive lung disease is asthma. All right, and then the final category, in terms of blood supply, alveolus, and bronchiole, is when you have a bad pulmonary blood supply. Now, that doesn't actually mean you have bad blood, like your name is Taylor Swift. What it just means is that there's something wrong in terms of the blood supply, such as too much blood pressure or blockage of the blood. And so too much blood pressure, it can really like push some fluids into the the alveoli. That's not good, right? So too much blood pressure in the lungs is called pulmonary hypertension, and the blood supply can also be blocked by a pulmonary emboli, right? And that's pulmonary embolism. All right, and then one more. So this is the disorders of the pleura. So right now you're probably like, bro, what's the pleura? Well, I'm about to explain it to you. So here's the trachea, bronchi, right? 2 lungs. So then the pleura is actually an outer sac. So think about an orange, right? It got its orange peel, right? And then it got the orange actually inside. Well, the orange peel is like the pleura. It covers the lungs, right? And then it has 2 layers to it. The parietal, which is on the outside, and then the visceral, which is on the inside. And then the lungs are in the innermost side, right? And then, so in between the pleura and the lungs is actually pleural fluid. Pleural fluid. It should just be the right amount of fluid. But you can always have it where there's either too much fluid or there could be gas inside the pleural cavity right here, right in between the pleura and the lungs. And so when you have too much fluid, that's called pleural effusion. And when you have air inside the pleural cavity, that's called a pneumothorax, right? So that's it for the overview of the respiratory systems and its disorders. It's your boy Jay signing out. For more information about the disorders in with the specifics, just go read and study. Just go and read the study guide. All right, see ya.